Hey everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Melissa and I'm a registered nurse. So in this lecture video, we are going to be covering the 5 rights of delegation in nursing, which you should be learning about in your fundamentals class if you are in nursing school. So we're going to go ahead and get started. So, when we are delegating as nurses, we are transferring routine tasks to other healthcare workers to allow us more time to focus on pressing matters or important things going on with our patients. Overall, delegation is an important aspect of nursing. It's actually considered a nursing skill because it promotes teamwork in healthcare. It helps to prevent nurse burnout because it's impossible for one person to do everything, and it ultimately allows for better patient care and better patient outcomes. So, now that we've gone over just a very general overview of why delegation is important in nursing, we're going to talk about how to delegate tasks in nursing using the 5 rights of delegation. So, the American Nurses Association has developed the 5 rights of nursing delegation to help nurses make safe decisions when delegating tasks. So, following these rights allows nurses to know what is safe to delegate and what is not safe to delegate. So, the 5 rights of delegation in nursing include the right task, the right circumstance, the right person, the right supervision, and the right communication. All 5 of these are important, and you are going to need to consider all 5 when making decisions on delegation. However, I personally would say that the right task and the right person are going to be the 2 most important rights of delegation. And I'm going to break down each of these rights, but just keep in mind when you're taking your exams in nursing school and when you're preparing for the NCLEX, if you get a tricky question on delegation, always make sure that you pay close attention to the task being delegated and who your options for delegating that task to are going to be. So we're going to go ahead and we're going to break down each of these rights, starting with the right task. Now, when you have a task to do in nursing, the very first thing to consider when it comes to delegation is whether or not you should even be delegating this task in the first place. So, when you're a nurse, not everything can or should be delegated to other people. There are certain things and certain tasks that you're just going to have to do yourself. So, typically, when you delegate a task, the task should be something that is minimal risk with a predictable outcome. So the task should involve little to no supervision needed, and it should be routine or repetitive. So simple tasks. You don't want to delegate tasks that are high risk with unpredictable outcomes to other people. Those are things that you should be doing yourself because at the end of the day, your license is on the line. If something goes bad, it will be a reflection of you and your license will be at risk. So assessing a patient after surgery is not a task that should be delegated. Right after surgery, even if the surgery went well, your patient is not stable. They need to be monitored for signs of infection. Their wounds need to be assessed. It's very important and unpredictable because a patient can seem fine right after surgery and then an hour later they can take a turn. So, the assessment of a patient right after surgery is not something that you can or should delegate to someone else, including another nurse. So, on the next slide, I've listed tasks that can and cannot be delegated. So here's a chart with a list of different tasks put into one of 2 categories: tasks that can be delegated and tasks that should not be delegated. So, under the first category of tasks to delegate, we have assisting with feeding. And assisting with ambulation, changing the patient linens, taking vital signs, administering oral medications, and reinforcing teaching. All of these are things that you can delegate to other people. If you're in nursing school and have already made it to clinicals, you may notice that this list consists of things that you are doing at the hospital in your clinicals. That's because these tasks have been delegated to you by the RN. So everything in this category can be done by an RN, but it can also be done by someone else. So, as a nurse, if you have a busy day, you have a lot of tasks to do, the tasks in this right hand column, the tasks to delegate, They're things that you can give to other people to take certain things off of your plate so that you have time to do more important tasks. Now, focusing on the other category, tasks that should not be delegated, we have things like nursing judgment. So I wrote this to be an all encompassing list of any task that requires nursing judgment. So, for example, if you are doing the first dressing change for a patient who came out of surgery, while that can be a repetitive task of taking off the dressing, cleaning the wound, drying the wound, putting ointment on the wound, and then wrapping it back up, you may go in to provide wound care to the patient, and then when you take off the dressing, the wound doesn't look right. It's inflamed, it's red around the skin, it's warm to touch when you feel it. You know that as a registered nurse, those are all signs of there being an infection. So, you as the registered nurse can use your nursing judgment to intervene. So, anything that would require that aspect of critical thinking and nursing judgment should not be delegated to anyone else. Again, including another nurse. If that's your patient, that's your responsibility. And then in this column, moving through the column, we have things like sterile procedures. That's because sterile procedures are high risk. They're considered high risk tasks. If they're done improperly, the patient is at risk for infection. So that's something that you need to be doing yourself. Next is developing care plans. So, developing care plans are using nursing recommendations for a patient's plan of care. Those things require nursing judgment, and they're tasks that should not be delegated to someone else. Administering IV medications. IV medications are not metabolized the same way that oral medications are. They're metabolized a lot faster in the system, which means that adverse reactions and allergic reactions can happen to your patient a lot quicker. So, when you're dealing with an IV, there's risk for infiltration, there's risk for infection. IV medications are considered higher risk than oral medications, which is why this is a task that should not be delegated to anyone else. Now, I don't want to jump ahead because we'll talk about this with right person, but some of you may be thinking that you've seen LPNs, which are licensed practical nurses, administering IV medications. LPNs can give IV meds depending on the state. So in the US, different states have different laws regarding what LPNs can do, what medical technicians can do. So in the real world, depending on what state you live in, administering IV medications can actually be tasks that are delegated to someone else. But when it comes to nursing school, the NCLEX, and when we're talking about this lecture, we're going to keep it under the list of tasks that should not be delegated since you can't do it in every state. And then lastly, we have patient education. So patient education must be done by the RN. It's not a task that can be delegated. And recognize the difference between patient education and reinforcing teaching. I remember there was a nursing exam that I had in fundamentals in nursing school where most of my class got a question wrong because the question was asking whether someone who was not an RN could reinforce teaching. Most of the class said no, myself included, and we were all wrong. So, to point out the distinction, initial education has to be done by the registered nurse. However, after that initial education has been completed and the patient has been taught something for the first time, whether that's how to do a task on their own, like change a dressing, or how to take a medication, like what time of the day to take it and how far you should space it out. That initial teaching must be done by the RN. But once that teaching is done, reinforcement of that teaching can be done by someone else. That is a task that you can delegate to someone else. Okay, now we're going to jump ahead and talk about the right person. So you have a task that you want to delegate. You have already gone through whether or not it is a task that can be delegated, and it is. So the next step is determining who to delegate your task to, which brings us to the right person. So, as the registered nurse, it will be your responsibility to delegate tasks to someone who is qualified and competent enough to complete the task that you are delegating to them. And what I mean by competent and qualified is that this person must have the necessary education, training, and expertise to safely perform the task that you're delegating them to do. So, in a lot of healthcare settings, and we'll just focus on the hospital specifically to make it a little bit easier. There are different people and different healthcare professionals that you will be working with. Three main ones in the hospital will be other registered nurses. So people that are on your level, they have the same credentials as you. You'll have licensed practical nurses. Sometimes they're called licensed vocational nurses or LVNs. And then lastly, you will have unlicensed assistive personnels. So in your exams, that will be abbreviated to UAPs. Now, if you're watching this video, you're likely in nursing school to become a registered nurse, and you know exactly what that is. But remember, the degree that an RN has doesn't matter in the context of delegation. So it doesn't matter if the RN has a master's degree, a bachelor's degree, or an associate's degree. They're still an RN. So in the real world, delegation to another RN will come into play if you are in leadership. So if you are a nurse manager or a charge nurse, you will be in charge of delegation to other nurses, other RNs. In the context of nursing school and the NCLEX on exams, you'll typically be given a task and there will be a multiple choice selection that you'll have to determine who's able to do that task. Luckily, it's easier to decipher what the RN can do versus other healthcare professionals because the RN can do everything that other healthcare professionals can do plus more. So here on this slide, I have just a list of tasks that are specific to the RN. So in healthcare, we like to say that all of these tasks are within a nurse's scope of practice. If there's a task that someone is permitted to do, that task is within their scope of practice. If someone is not allowed to perform a task, then that task is considered out of their scope of practice. That's the term that we use. So everything on this slide is within the RN's scope of practice, and you can delegate any of these tasks to another RN that you're working with.
So that includes the initial assessment of a patient. I actually learned that from Mark K when studying for my board exam, that anytime you're doing something for the first time on a patient, the RN should be doing it. So the initial assessment after a patient is admitted, that needs to be done by the RN. The initial assessment post-operatively, so after an operation or after a surgery or a procedure, that should be done by an RN. The first wound change after surgery, first set of vital signs, all of that needs to be done by the nurse. And the reason for this is that during all of those initial assessments, you are getting the patient's baseline, and it is vital for the RN to do this. For patients that are post op, they're not considered stable right after surgery, and the RN needs to be conducting assessments and providing care to unstable patients because this involves clinical judgment, which is something that we talked about earlier during the right task. So, if an unstable patient is being cared for by an RN and something isn't right with them, whether they're showing signs of infection, shock, allergic reaction, whatever, in theory, the RN has gone to school and has been trained to be able to identify bad things going on with the patient and intervene as quickly as possible. So, initial assessments and care of unstable patients are both important and high risk. So, the RN is the healthcare provider with the appropriate education, training, and skill set to perform those tasks. So, now moving on to interpreting and analyzing data. This is something that can only be performed by the RN as well. For example, when a patient's blood is drawn and taken down to the lab, their results come back and we receive data on their blood work. This tells us their H&H, which is their hemoglobin and their hematocrit. It tells us their white blood cell count. It tells us their electrolyte levels. If you're watching this video, you may be in fundamentals and you may not have learned yet what all of those labs mean in relation to how they impact the human body, but you will at some point in nursing school. So by the time that you finish your nursing program and you become an RN, you would have received the education and the training on how to look at different lab values and tell how each of those values are going to affect your patient. Therefore, as an RN, you will have the appropriate education, training, and skill set to look at that data which would be those lab values, and then be able to interpret them, which would be determining how they impact your patient. So, moving on, care plan and development and patient education. In general, anything that falls under your nursing ADPI, which is the assessment, diagnosis, planning, implementation, and evaluation, all of those tasks in those 5 categories must be performed by an RN. And then everything else on this slide is considered high risk or involved critical nurse thinking. So they do need to be performed by an RN. So now, tasks that can be delegated to licensed practical nurses, which are LPNs, or licensed vocational nurses, which are LVNs. I believe the NCLEX and most of your nursing exams will probably say LPN, depending on what state you live in. But everything that I have listed on this slide would be under their scope of practice and things and tasks that you can delegate to these people. So, medication administration for oral, topical, and injected medications can all be delegated to an LPN. So, this means intramuscular and subcutaneous. Again, I want to stress LPNs cannot administer IV medications. Again, it's depending on the state, but when we're talking about for your exams and your board exams, LPNs cannot administer IV medications. So each state has its own rules on what LPNs and CNAs can do. But again, we're talking about in general. So moving on, LPNs can insert Foley catheters and NG tubes. They can perform trach care. They can reinforce patient teaching. So, again, there's a difference between that initial teaching, so patient education, and then just reinforcing what has already been taught. LPNs cannot do that initial teaching, but they can reinforce after the RN has already done the initial teaching. So now we're moving down the line of right person to UAPs, which are unlicensed assistive personnel. So everything on this list is for patients that are stable. RNs should not delegate tasks that need to be done on unstable patients because, again, if there's a change in status for the patient, the nurse needs to know immediately. So it's risky to delegate even the most basic tasks to someone that is considered unstable. So, assuming that the patient is stable, the RN can delegate any of these tasks and can honestly delegate any task that falls under the category of activities of daily living, or ADLs for short, to the UAP. So that would include ambulating. So this could be walking, sitting, standing, laying down, or getting up. Grooming. So that would include brushing a patient's teeth, brushing their hair, bathing the patient, shaving the patient. Then toileting. So helping the patient use the bathroom, helping them clean and wipe themselves up after the bathroom, dressing the patient and undressing the patient, eating, whether that involves feeding them fully or just cutting up their food to make it easier for them to eat and chew. And then lastly, taking vitals. So blood pressure, respirations, oxygen saturation, heart rate, blood sugar. They can't analyze those results. So only the RN can actually analyze and interpret those results, but UAPs can still take vitals. So as a nursing student, you are considered a UAP, an unlicensed assistive personnel. So if you're doing your clinicals, or when you start doing your clinicals, everything on this list are things that you are going to be doing, especially in your first semester of clinicals when you're doing fundamentals. You're going to probably be watching RNs administer medication, but you won't be able to do that yet. Instead, they will probably have you helping patients like walk, brush their teeth, get ready for the day, toileting, eating, all of that stuff, because those are tasks that they're able to delegate to you as an unlicensed assistive personnel. So now we're going to talk over the right circumstance. Before a task can be delegated, the nurse first has to assess the situation and ensure that it is the right circumstance. So now when it comes to right circumstance,
The right circumstance involves the RN making a professional assessment of the patient's nursing care needs prior to delegating. So, in order for the RN to determine the right circumstance, they must first assess the patient's nursing care needs. So, some important factors to consider when we're doing this is to look at the patient's stability. So, we mentioned earlier that unstable patients should ideally be cared for by the RN themselves, and it's not ideal to delegate any task for an unstable patient. However, a patient's vitals could be stable and the patient overall could be stable, but they may have difficulty chewing or swallowing food, for example. In this case, the patient's circumstance makes it appropriate for the RN to delegate the task of routine vitals to a UAP. But even though a UAP would typically be the one assisting with feeding, if a patient's having difficulty swallowing and chewing, it's not the right circumstance for the RN to delegate that task to the UAP. It's also important to factor in the healthcare setting and available resources. So, not all healthcare settings even have UAPs or have LPNs. And the other medical resources available in some healthcare settings are going to be different than in others. So that is something to take into consideration. I used to work in a nursing home, and the nursing home that I worked in had medical techs or CNAs. It had nurses, both RNs and LPNs. And so the RNs were able to delegate tasks to the techs, they were able to delegate tasks to the LPNs. I now work in a hospital that does not have LPNs. So, as a nurse, I can delegate tasks to other nurses that are RNs. I can delegate tasks to UAPs, but there are no LPNs that I can delegate tasks to. So, every healthcare setting is going to vary. Your resources are going to vary, and that is something to consider. Now, moving right along, the next five rights of delegation that we're going to cover is the right supervision. So, when delegating, the RN needs to ensure that appropriate supervision is provided to ensure that the delegated task is actually being performed correctly and safely by the person performing that task. So, the right supervision really involves follow up. Even when a task is delegated by the RN and that task is actually completed by someone else, the RN is still responsible for that task and for the outcome of that task. The purpose of delegation really is to lighten the RN's load and to distribute work more evenly and more fairly. The purpose is not to just dump work onto other people and, wipe your hands clean of it and just to walk away. So, after the nurse delegates the right task to the right person under the right circumstance, it's then the nurse's responsibility to provide the right supervision in the form of providing guidance, feedback, and support as needed. So, if the RN delegates a UAP to assist with toileting and the UAP comes back 5 minutes later and asks for clarification and help, the RN is obliged to do so. If the RN delegates an LPN to insert an NG tube or a Foley catheter in a setting that's appropriate, it is the RN's responsibility when they have time to go back and ensure that that task was completed correctly. If it wasn't, then it's the nurse's job or the RN's job to address any issues. So if something is done incorrectly by an LPN or a UAP and it has an adverse outcome or a bad outcome for the patient, it's the RN who delegated that task ultimately who is responsible for the negative outcome. So if something bad happens for one of your patients, you're the nurse of a patient, something bad happens with a task that you delegated to a CNA or a med tech, the person that is going to get in trouble, the person whose license is on the line at the end of the day would be yours because that is your patient and you are the RN. And last but not least, we have the right communication. So, when delegating a task, there needs to be very clear communication between the person delegating the task and the person who the task is being delegated to. So, bad communication can increase so many issues, especially in healthcare. When delegating a task, the RN needs to provide clear and concise instructions about the task being assigned. This includes the purpose of the task. detailing exactly how the task should be performed, and addressing any questions or concerns that the person being assigned the task has. This ensures effective communication and it decreases the risk for any errors. So that is it for this lecture. That was a quick overview of the 5 rights of delegation in nursing. If you have anything to add, or if you have any questions, please feel free to comment down below or send me an email. I always put my email in the description box. It is theluckynurse@gmail.com. Thank you for watching this video. Hopefully it was helpful, and I will see you guys in the next one. Bye.